You're having a stroke, but the doctor doesn't pick up on the signs. There's a big chance that is happening if you're a woman or minority, according to new research from Johns Hopkins University School of Medicine. Joining us this morning is Dr. David Newman-Toker, who headed up that study. And, I got to thank you much for being here. And I think, first of all, we got to talk about the minority groups. Who are we talking about here, sir?
Thank you for having me, Rick. So we're talking about non-whites, particularly African Americans and Hispanic Americans.
And what are the signs that seem to be overlooked in this study that you did?
Well, what we found was that the patients who had strokes, when their symptoms initially manifested things like dizziness and headaches as opposed to weakness on one side of the body or slurred speech, were particularly likely to be misdiagnosed.
Let's go back to what people may not know. I mean, what is a stroke, first of all?
Stroke is generally a lack of blood flow to a part of the brain that causes that part of the brain not to work properly. And sometimes it can present with early manifestations, sort of mild pre-stroke type symptoms that can be caught early and treated and prevent going on to a major disabling stroke.
Why do you think they're misdiagnosing some certain groups here?
Well, I think part of the problem is that these are challenging symptoms. They're common symptoms, dizziness and headache, and not all patients who have them have stroke as a cause. But it's also that there have been shown to be some subtle biases that come into play when people are women or minorities who are more likely to be missed just because they're not being paid attention to at the same degree.
Okay, all right. Everybody at home, and Doc, look at your TV screen right now. We've got a little scan here for you. This is, we have a brain scan that you brought in, and it can tell us more about this when we see this up on the screen in just a moment. There we go. Now, what is this, Doc?
So this is a scan of an MRI scan of the brain. This is at the top of the screen is the patient's nose. It's as if you sort of put your head in a bread slicer, and at the back, there's the back part of the brain called the cerebellum that controls our balance. And there's a big white spot there on the right-hand side of the screen that represents a big stroke. And that stroke, which was the size of a golf ball, was in a 30-year-old. And it turns out that young people are the less likely to have strokes. When they do have them, are about 7 times more likely to be misdiagnosed than people over the age of 75.
How many people do you think have been misdiagnosed?
Well, there are probably millions of people every year that are misdiagnosed in the U.S., and probably about 150,000 or more that die or suffer permanent disability each year in the U.S. as a result.
That's scary.
It's scary.
So basically, if someone is having a medical condition that we may not know is a stroke, and then it's later found it was a stroke, and that's why that person may have had illnesses or may have passed.
Yep, there's no question that if we don't have that opportunity to intervene early, sometimes the disease progresses to a point where there's nothing left that we can do.
You got me thinking here, Doc. What do I need to do? What do people need to do to make sure that we don't get those symptoms, or we're able to recognize them? I mean, the first one when it happens.
Well, I think the first thing for patients is to come prepared. So they've really got to have their medical history of their symptoms and their problems ready for doctors. So everybody should be prepared with their own personal medical history and write down their symptoms as they go along. The second thing is, I think that people really need to avoid blind faith in the doctor. Ask probing questions. Ask the doctor, could this be something more serious? Is it possible that we're missing something here? And then when you go home, be willing to reconsider the diagnosis. Don't just assume because you got the label that that's necessarily what you have. And if things go off script, if you're planning to have if they tell you you're going to get better over the next few days and you get worse, then rethink it. Go back.
Excellent information, Doc. Excellent information. And for more information on Dr. Newman-Toker's study, you can head to our website, foxbaltimore.com/morning.